Hello everyone, my name is Emilie Courtin. I am Associate Professor at the London School of Economics, where I lead the LSE Health Inequalities Lab. So my research is motivated by a simple fact. Growing older is inevitable, but how fast we age is not. Two people can be exactly the same age in years and yet have very different biological ages. Why is that? Well, we know from the existing research that people who grew up in poverty will be facing a steady stream of stressors, starting in the womb, through their childhood, and into their adulthood. And those stressors can accelerate their biological aging. This is important because accelerated biological aging is a key risk factor for poor health, higher chances of disability, and higher risk of premature mortality. So the best solution that we have to tackle those social inequalities in healthy aging are early life social intervention. Think, for example, of parenting or schooling intervention, all implemented early in life, long before harm accumulates. However, proving that those social interventions implemented in early life can actually improve health and potentially slow down biological aging has proved very difficult. And this is because our traditional health metrics, for example, think of cardiovascular disease, will take decades to appear. So if we implement today an early life intervention, we might have to wait until 2050 or 2060 to actually see its benefits on health outcomes. This is not practical for us as researchers, and it makes it particularly challenging to convince policymakers to invest today in those early life interventions when they will see the benefits far away in the future. So in my work, I tackle this challenge in two ways. First, I revive historical high-quality trials, what I call dormant trials, by linking them to routinely collected administrative health data to understand their long-term effect. And second, I integrate into my work innovative measures of biological aging, for example, epigenetic aging clocks, that can detect meaningful changes in health within years rather than within decades. So let me give you two concrete examples of how I do that in my ongoing work. The first example comes from Tennessee in the United States with a Project STAR trial that was implemented there in the 1980s. Project STAR randomly allocated children either to a small class size or to a normal class size when they were in kindergarten. Those kids allocated to small class sizes had large and lasting benefits. They had higher test score, they were more likely to graduate from high school, to go on to college, and ultimately they had higher earnings. The intervention radically reduced racial disparities in educational attainment. Those kids, they are now in midlife. And that gives us a really unique opportunity to ask whether that intervention that improves their socioeconomic outcomes also improves their health outcomes. This is what I'm currently doing by linking the original trial to mortality records to understand whether that intervention also reduces premature mortality. As part of this project, I've also run a recontacting trial. Basically, how do you get back in touch with participants 40 years after the original intervention? A third of those we recontacted said they would be willing to participate into a larger, broader health study. This opened the door to collecting new health data as part of one of our largest and most successful educational interventions. The second example comes from Dublin in Ireland. The Preparing for Life trial is the longest running parenting intervention in Europe, and the participants are now age 14. We have just finished collecting salivary samples, and our preliminary findings are showing that the intervention has a positive effect on a number of epigenetic measures and that it might be slowing down epigenetic aging. So in sum, at a time where disparities are increasing across the globe, my work can help us understand why those disparities in healthy aging are happening in the first place, and crucially, how we can remedy them.